The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
Good evening, everyone. Welcome to another episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle. I'm Anupama Menon. Good health is not a destination, it's a journey. In this talk show Health World, we have expert doctors from various fields answering queries and providing valuable information on various medical topics to assist you all on your journey towards good health. 29 September is the World Heart Day. A heart that beats right stays right, and a healthy heart puts the whole body at ease. But as we know, heart diseases are on the rise. It's quite rampant these days, and sadly it's one of the most important causes of death in today's times. So to throw more light on the topic of cardiovascular diseases, we are happy to have with us Dr. Muzafar Ali Surhio from Al Hilal Hospital, Muharrak. He's a consultant cardiologist there and has an experience of over 30 years in the field of cardiology. Thank you for joining us, Doctor, and welcome to the show. So, Doctor, what exactly is the purpose behind observing 29 September as World Heart Day?
Well, it's a good question. So, every year we are celebrating on 29 September World Heart Day. The health community, they are very conscious to take preventive measures to decrease the cardiovascular disease. What I observe, it's a biggest awareness and raising and perfect platform to decrease the cardiovascular disease. It's a global campaign in which the families, individuals, communities, government and private sectors to take active part in this healthy activity to decrease the cardiovascular disease in population or decrease the cardiovascular disease burden worldwide. Our aim to decrease cardiovascular disease at least 25% or more than that by up to 2025. Apart from that, this activity is a public awareness, and we need to aware the public to take healthy steps to decrease the cardiovascular disease. Now the heart, it start to beat from third week of conceived. That means when mother becomes pregnant or pregnancy intervene, after the third week of that, this part of the vessel start beating till the end of the life. So average life is 60, 70, maximum 80 years. So heart continue to be beating up to 80 years. If we count this heart beating, so the average heartbeat 70 to 80 beats per minute. In a whole lifespan, if we count the heart beating at least 2.5 billion times or more than that, the heart continues to be beating till death. So I would say it's a first and a last sign of the life. So it's a very important campaign for public awareness, and public should take part to decrease the cardiovascular disease burden among the population.
Yeah, especially because heart diseases are on the rise nowadays. So I guess awareness will really help a lot to kind of bring it down.
Yes, excellent.
And doctor, you spoke about cardiovascular diseases. Could you please be more specific and tell us exactly, for the benefit of the viewers, what are the different kinds of cardiovascular diseases?
Well, cardiovascular is a two parts, cardio plus vascular. Cardio means heart, vascular means the vessels, blood supply. So we say cardiovascular disease, particularly we are focusing heart and vessels. Vessels means particularly brain. So heart disease and brain disease. The brain disease, we should say the stroke.
Okay.
So heart, the heart having 4 chambers. From the left side, heart beating, and the blood go towards the whole system where there is nutrients and oxygen supply to the body, and from that the metabolic waste product and carbon dioxide to bring back to the right side of the body. From the right side again blood go towards the lungs where get oxygenated, and then again come to the left side, then again blood pump to whole body. So this process has been going on continuously, as I mentioned, 70 to 80 times per minute. Yeah. So the blood supply of the heart is called coronary arteries, coronary vessels. You see in public they are written CCU. CCU is a particular, that means coronary care unit. This coronary name with a heart blood supply, and another blood supply to the brain, cerebrovascular we say. So when there is any problem in the brain vessels, we say either cerebrovascular accident or stroke. For the heart, when we say, when these coronary becomes blocked, we say heart attack. So it's equal, heart attack or brain attack. Brain attack we say stroke. So apart from other blood vessels, we are the focusing main to heart and brain. So we say cardiovascular disease.
Okay.
So this means like that.
So mainly it's heart attack and a stroke,
and
which comes under the purview of cardiovascular diseases.
Yes,
and what are the risk factors that could lead to these issues?
Well, there are many risk factors. We divided these risk factors into 2 categories. One, the fixed, another the modifiable. The fixed risk factors are like increasing age, and male sex, the family history of the heart problem, and ethnic origin. These are 4 fixed risk factors we cannot change. Others are modifiable risk factors. These are 9 modifiable risk factors. This worldwide, not from the here, one country, worldwide. The Inter-Heart study that mentions 9 modifiable risk factors. Among them, for example, dyslipidemia, that means cholesterol increase, diabetes, hypertension, obesity, smoking, and sedentary lifestyle. Nowadays you observe everybody on media and this not doing exercise. So sedentary lifestyle is more important. Unhealthy diet, doing less exercise. So these are the and alcohol taking,
stress and
smoking,
tension,
psychosocial stress, tension. There's a total 9 risk factors. They're leading to the cardiovascular disease. So they clearly mention there are 90% risk of the cardiovascular disease from these 9 modifiable risk factors. So it's in our hand to modify the lifestyle. That's why we organizing this public awareness, this World Heart Day. this public awareness to do the exercise, modify the risk factors. So, if they modify these risk factors, we can prevent at least 90% premature cardiovascular disease, that means heart attack and stroke.
It's very comforting to know at least the health of your heart is in your own hands, you know,
Yes,
something that
exactly.
we can take care of.
Exactly.
So, you spoke about lifestyle diseases like diabetes and cholesterol contributing to cardiovascular diseases. So, is there any plan to modify these risk factors? How do we keep these things in check?
Well, this is a good question, and our aim for this activity to modify these risk factors for public awareness. For example, the smoking, diabetes, obesity, hypertension, and socio-economical stress. So, for example, smoking, we have to counsel with the patient interaction to quit smoking because there are many hazards of smoking. If he or she has difficulty to quit, then proper counseling, and there is a alternative because the smoking contains nicotine. In market there the nicotine replacement therapy is available.
Okay.
Now another, if patient want to quit smoking within 2 years, there is substantially decrease coronary artery disease. Up to 15 years of quitting smoking, the smoker and non-smoker becomes equal. So, the big benefit of quitting smoking.
Okay.
Apart from that, if you see in the population, there is air pollutions. The air pollution at least 25% leading to the cardiovascular risk factors. So, it is better to use bicycle or other means. If there is a short distance, he or she can walk.
It's an exercise as well, and
also.
air pollution will also be reduced.
Will be decrease the cardiovascular risk. For obesity, for example, the ideal body weight is very important. 18.5 to 24.9 BMI. We are calculating BMI, not simple obesity. BMI means body mass index, height in centimeter, weight in kg. So, this 18.5 to maximum up to 25 or less than that. This is the ideal body weight.
Healthy BMI.
More than that, we say overweight.
Okay.
That means up to the 30, we say overweight, and more than 30, there is the obesity. There are the multiple classes, class 1, class 2, class 3, but up to 30, there is the overweight. More than 30, this is the obesity. So, if obesity, there are many hazards on the body. So, it again leads to the hypertension, leads to the diabetes mellitus, dyslipidemia, and joint problem. And also this one, if obese person is also psychosocial stress.
Yes.
So, ideal body weight is very important. Apart from that, the underweight is also the risk for the health. That means if the minimum is 18.5, if less than that, that means 17 BMI, 16 BMI or less than 16 BMI, these are the categories of the underweight. So, if the underweight, again risk for the health. For example, malnutrition, vitamins, minerals, there are the disturbances. If teenagers, there are the growth disturbances. In female, there is a menstrual cycle and hormonal other change disturbances. So, this awareness, this World Heart Day, the awareness to keep the ideal body weight. Apart from that, the diet is very important. We inform by this platform to decrease the sugary diet, because sugar taking is the main problem apart from cholesterol. Okay. If you take 1 tin of the Pepsi, it contains at least 125 to 130 calories. And if you do the exercise, for example, 6 mile running, you burn maximum 300 calories. So, this Pepsi or other beverages, the extra calories apart from your food. So, diet control is more important as compared to the exercise. The exercise is very important, at least 5 days in a week, 30 minutes brisk walking or more than that. Some are doing 60, 75, it's very good for the health. It will decrease the blood pressure, weight, improve the cholesterol, sugar also. So lifestyle modifications very important. Apart from that, diet, we have to take the fiber diet. For example, the vegetables and the peas and lentils and cut peas. These are contain more fibers. For example, the 1 cup of the lentils that contain at least 16 gram, and same as a split peas, they contain 16-17 grams. Oat, raspberry, blackberry, and avocados, these are very important with fiber diet to lose weight and improve the health. So lifestyle modification with these measures, it will further decrease the premature cardiovascular disease and stroke.
Doctor, speaking about diet, eggs are known to be a very good source of protein, but there's also a conception that if you have too much of eggs, it's very high in cholesterol. So normally heart patients are advised not to have the egg yolk. Is it true? I mean, is it a myth, or is it true that eggs contribute to high cholesterol?
This is an excellent question. Patients are also asking this question from us, whether because the egg, everywhere we will go, some contents of eggs.
Even in cakes you will find,
yes,
desserts, sweets,
so
everything.
If we look into the eggs, the egg contains 2 parts, egg yolk and white. The cholesterol present in the egg yolk, while the white that contain only protein. So cholesterol in the egg yolk, at least 184 or 186 milligram in this 1 egg yolk cholesterol present. So if person want to take egg, 1 egg per day is enough. 1.5 egg per day is enough.
Including the yolk or only the egg white? Including the yolk, okay.
Whole egg, because we need at least 300 milligram cholesterol per day. So as I mentioned, 184 or 186 milligram cholesterol in 1 egg yolk. If you will take 1.5 or maximum 2 egg, it will daily requirement of the body. The difference of this egg yolk and outside cholesterol, for example, person used to go pizza, McDonald's, burger, that contain hydrogenated fat. The body behave differently. That's hydrogenated fat, and this is a natural cholesterol in the
which
body,
is required for the body.
Which is required for the body, and this is healthy diet.
Okay. So even a patient who is prone to heart disease, they can very well take maximum 2 eggs up to day without any concern.
They can. Yes, they can take.
Okay.
This is a daily requirement of the body.
Okay, and try and avoid junk food and then include
this is the main of our issue, to avoid fast food,
outside food and junk food,
because that cholesterol body behave differently
in a different way.
The natural cholesterol in the vegetable or egg or others.
And doctor, in your observation, how widespread are these risk factors? Because you must be coming across a lot of patients. So what are the most common risk factors that you've seen, and how widespread is it?
Well, we say this is the prevalence of the disease, and heart attack and stroke, the most we can say the leading cause of the death worldwide. 18.6 million the persons death per year. This is worldwide.
That's a huge number.
This huge number, 18.6 worldwide death per year. Only if in America there is a 14 or more than that patient with coronary artery disease. Among them, 1.5 million that develop heart attack. Now among these patients, 0.5 million, that means 500,000, they becomes passed away, and most of them due to the heart attack and passed away within few seconds to minutes. So this is a big number of coronary artery disease among the population and worldwide. if we compare this data with international incidence of coronary artery disease, and we observed almost is equal to the American data which I mentioned. So in this way, we know that there is a big number of the coronary artery disease among the populations.
Yep.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
So doctor, we spoke about BP, cholesterol and sugar as one of the major risk factors that contribute to cardiovascular diseases. So what are the ideal levels to be maintained for these three issues?
Well, there is two main organizations in the world. One is American College of Cardiology, one is the European Society of the Cardiology. The cut point of both organizations are a little different. For example, American College of Cardiology and American Heart Association, they mention that blood pressure 130/80 or more than that, they consider this is high blood pressures. While on the other hand, European Society of Cardiology mention the blood pressure 140/90 or more than that, they considered high blood pressure.
There's a difference of just 10
so
points.
10 points. So our aim to when patient with high blood pressures, while we are treating with lifestyle modification and with medicines, pharmacological treatments, our aim to keep blood pressure within this target level. So that means,
is it the same for all ages? In elderly people also, is the same level applicable or is it different?
yes, this is the same target and same definition for all
age groups.
All ages. So we keep blood pressure at least 130/80 to control. This is our target. But as you mentioned, age group, for example, elderly age, fragile. So we cannot keep tight blood pressure control. That may risk of fall, because there is elderly people, they are taking, because this is a comorbidity, taking diabetic medicine, cholesterol medicine, other osteoporotic medicines. So they may sometimes taking medicine, they are not taking their proper food or other, and they may cause low blood pressures. So in elderly patient, 140/90 or even up to 150/90 is acceptable to keep target level. But overall, if patient is young, dynamic, we have to keep blood pressure between this range. As I mentioned, two organizations, 130/80, its target goal, or less than that, and 120/80, 125/80, 85 acceptable. But in some patient, what we clinically observe, the blood pressure remain up to 135/85, so it's also acceptable. But some patient, for example, patient with blood pressure 160 and 95. We given pharmacological treatment apart from the lifestyle modification. The next visit, patient will come and blood pressure, for example, 155/95. Some patients are asking, there is no any much difference of blood pressure. Before 160, now 155, or 150. Before 95, now it's 90. So no much difference. But the data suggested 2 millimeter systolic blood pressure decreased, it will lead to the 10% cardiovascular mortality decrease.
Okay.
Even 2 millimeter of mercury. So in this, as I give you an example, we decrease 10 millimeter to reduce the cardiovascular mortality. So layman does not know behind this what's the benefit which he got. So in this way we have to discuss with the patient, counsel to the patients, you got much benefit, and follow the lifestyle modification. We would escalate the dose of the treatment and be compliant with the medicine to keep the target level, you will get much more benefit. Apart from blood pressure, as you mentioned about the diabetes and cholesterol. There are two types of the cholesterol. One is a good cholesterol, other is a bad or harmful cholesterol. We say HDL and LDL. So LDL is a harmful to the heart or whole body. So normal range of LDL up to the 130 milligram per deciliters. So our target to keep the LDL less than that. But if patient having a diabetes, coronary artery disease, so our plan to keep this LDL harmful cholesterol as low as possible. At least some this organization suggests keep less than 70. Some say keep more less than that, because if you keep this LDL cholesterol up to for example 40 or 40 milligram per deciliter, it will decrease the subsequent heart attack.
Okay.
So this LDL cholesterol is very important to keep within target level associated with the risk factors. Now diabetes is very important. Now one patient having a diabetes, other patients having a coronary artery disease, that means heart attack. So diabetic patient and this heart attack patients are equal. So diabetes is very dangerous, it affects every system of the body, and we say these risk factors, for example hypertension and dyslipidemia, diabetes, these are the silent killer. For example high blood pressure, what we observe in the clinical practice, patient becomes asymptomatic, no headache, no chest pain, nothing, and suddenly patient came with a stroke, patient came with a heart attack or kidney failure. So this campaign which we are celebrating, the public awareness to follow the lifestyle modification, regularly check up with the doctor or blood pressure, sugar, cholesterol, stop smoking, to prevent the premature death, and that means mortality and morbidity. Regarding this sugar level, so we have fasting and random and HbA1c. HbA1c, this part of the test we are assessing 3 months back. For example today patient giving blood, from today go 3 months back to see the sugar level control
of the sugar
not
level.
controls. So at least we keep this less than 7. Some authorities say 6 or 6.5 is acceptable. Fasting blood sugar 90 to 110, 120 is acceptable. Okay. So sugar, cholesterol and blood pressure is very important to keep control and prevent the premature cardiovascular death.
What is the difference between primary and secondary cardiovascular diseases?
Well, because I mentioned multiple times,
Yes.
prevention, primary prevention and secondary prevention, there are little difference. The primary prevention, that means when patient having these risk factors like diabetes, hypertension, cholesterol, obesity, sedentary lifestyle, these are risk factors for the heart attack and stroke. By this campaign, this is the public awareness to prevent the heart attack, to modify these risk factors. Risk factor, for example, one patient having a diabetes, other having a cholesterol, and third one is the blood pressures. These are the risk factors for the heart attack and stroke. So by this campaign, this leads to the public awareness to keep control these risk factors to prevent the premature morbidity and mortality. This is a primary prevention. That means there is no heart attack, but risk factor is present. Diabetes, hypertension, cholesterol. Any one of them, there is but this public awareness patient to keep tightly control, do the exercise, ideal body weight, stop smoking, walking to prevent the heart attack. This is the primary prevention. Secondary prevention does means when patient having any one of them. For example, patient with a heart attack, patient with a stroke. Now patient going subsequently follow up to prevent further heart attack or stroke. So this is the secondary preventions. By secondary prevention, same patient need lifestyle modification, patient having a regular follow up with the doctors and taking proper medicines to keep the control. These are risk factors. So this is a little difference. Primary prevention
for those who have not had it before.
And secondary prevention, patient had attack already, and to prevent subsequent attack to follow up these guidelines.
Okay. So doctor, before we wrap up, any takeaway message for our viewers, anything you would like to share with them on this World Heart Day?
Well, this our message for public. The heart is the fist size organ, is continuously to beat, okay, with a strong muscle in the whole body. The heart is the only where the strongest muscle to start, as I mentioned, from third week of life till end, that means 80-90 years continuously to beat. Now our aim, that means healthcare, being healthcare, our aim to keep control these risk factors, and it's our fundamental human right to keep heart healthy, and it's a crucial element for global health justice to prevent the cardiovascular disease, morbidity and mortality prematurely. So heart is a precious organ. By this activity, by this campaign, this is a main aim to prevent the disease and for the public awareness. So for a heart, you can only hear, listen, feel and use your heart to do right decision, right action, and with the public awareness and inform you are being a healthcare professional, we discuss with the public to decrease the risk factor, do the exercise, decrease the weight, good and healthy diet, keep his or her heart healthy and make the society beautiful, healthy.
Thank you so much, doctor. Thank you for sharing so much of valuable information on cardiovascular diseases.
Okay.
Appreciate it. Thank you.
Many thanks for invitation. Okay, thank you. Thank you.
So friends, a healthy heart is in your hands. Take care of your heart and your heart will take care of you. As doctor suggested, have the courage to say no to smoking, no to sedentary lifestyle and no to unhealthy eating habits. Do follow a healthy lifestyle. Try and avoid stress and tension as much as you can. Stay healthy and happy always. For more informative and valuable episodes like this, don't forget to tune in to BMC Global Live Al Hilal Health World every Tuesday at 8 p.m. Till we meet again next time, this is Anupama signing off. Good night and stay safe.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and